This is part 4 and the final episode of Special Needs Pregnancies. We're going to discuss adoption and surrogacy. So, adoptions can take place as closed versus private, as well as open. So, a closed or private adoption, the birth mother and the adopting parents know nothing about one another. In an open adoption, birth mother and adopting parents know something about one another. There are many forms of getting to know one another with minimal exchange of information, but some of them become intricately involved in one another's lives, and the more intricately involved they become makes it more difficult for the birth mother to actually give up the child. In an open adoption, the birth mom may room in with the baby until discharge or relinquishment of the child. Sometimes the baby goes with the adoptive parents prior to the birth mother being discharged. If it's been arranged, the adoptive parents may or may not be present during the labor and delivery. Remember that the nurse needs to teach the adoptive parents, as well as the surrogate parents, what they need to know about taking care of a baby. They need to be taught what we would teach any postpartum mother, except we don't have to go through the care of the birth mother. And remember that the birth mother has the same physical needs as any other postpartum patient, but has additional emotional and psychological needs related to giving up her child. Remember that an adoption is not finalized until the baby is born, and the birth mother or the adoptive parents may change their mind. The birth mother has the right to parent her child until her consent to the adoption becomes irrevocable. And this is true even if she has already placed the child with the adopting family. In the case of the adoption of the newborn, the most common time of signing the consent is within the first week of the child's life. It becomes irrevocable on the 31st day after signing. The birth mother can also sign a relinquishment document with a licensed adoption agency. Some adopting families work with an agency in addition to their own attorney. A relinquishment becomes irrevocable once it's accepted by the Department of Social Services in Sacramento. Now, if this adoption occurred under duress or incompetency of the birth parent, or it was a fraudulent adoption, then the adoption can be overturned. Now, you may be wondering, why would adoptive parents change their mind about taking the baby? Well, as you know, there is no guarantees of a perfect baby. And they may find out that this baby has been exposed to drugs unknowingly. The baby may have a birth defect, but something along, or it may be premature, and they decide, nope, we wanted the perfect child. And so they will back out of it. Similar things can happen with a surrogate pregnancy. So we have different types of surrogate. We can have a surrogate that just uses their egg and the sperm. We can use the intended parent's egg and sperm. So it gets to be sticky, okay? The thing is, what you really need to know is you want to provide the same care to surrogate mothers as you would to any other patient who comes in for prenatal care, intrapartum care, and postpartum care. And so when we look at these two pictures, we can have a gestational mother with intended parents. And so the gestational mother can provide her own egg and then the intended father's sperm, or we can have the gestational mother just serve as the carrier, where she gets the intended mother and the intended father's sperm. Or when you look at the babies that are on the left, we have same sex partners who donate their sperm and they get a donor egg. So there's a lot of legal issues that go on with this. But remember, similar to the person who is giving their baby up for adoption, the surrogate parent goes through the same or similar type of loss when giving up a baby that they've carried for 9 months and go through labor and delivery. It's imperative when this surrogate mother is getting prenatal care that she is well schooled in the risks of pregnancy in and of itself, because her risks are going to be the same. She can have the same kind of complications because there's no guarantee on any given pregnancy that everything's going to go normally. So this ends the lectures on special needs pregnancies.